Now let's consider what Dr. Georg Schlieper had to say. And first of all, I'll just talk about his overall findings after performing this therapy for several years, and then we'll consider some of the case studies. So first of all, he has treated 24 ME-CFS patients over the last few years. And although, as I say, this is not part of a randomized controlled trial, this is simply sharing anecdotal information, it's still very interesting. And so what he did, very basic, is he just asked people a health questionnaire before treatment and then again 4 weeks after, and also a visual analog fatigue scale. Now these are very, very straightforward, but nevertheless they can give us a lot of information. So with the health questionnaire, it's simply asking people, how good or bad is your health in general at the moment? And 0 is like the worst you could possibly imagine, and 100 would be you're totally free of all disease and you are, it's the best you can imagine, you're off climbing Mount Everest or whatever. And then there's the analog, and then the fatigue scale is simply asking people to describe their global fatigue in general, with 0 being terrible and 10 being normal. So he got people to do these before and then 1 month after the treatment. And so out of the 24 patients, these were the basic results. And so what we see on the left with the general health questionnaire, before immunoadsorption, people were at around 35% of what they would wish for their health to be. And 4 weeks after immunoadsorption, this had risen to around 56-57% of where they would like to be. And that's a very significant result in the context of ME-CFS, particularly when this is like in comparison to where people would wish for their health to be at an optimal level. So to be at 57% when you have ME-CFS relative to what you would wish to be overall is actually pretty good.